U equal U, undetectable equal untransmittable, or K equal K, is a global community campaign. It's based on the research showed that people with HIV who have good treatment and HIV viral load range below 200 will not be able to transmit HIV to their sexual partners. In Vietnam, the K equal K propagation campaign was launched in mid-2018 and actively implemented by the U.S. Centers for Disease Control and Prevention, CDC in Vietnam, the Network of People Living with HIV in Vietnam, Vngncb+, and the Ministry of Health agencies. By very soon information on the effectiveness that the treatment process can bring, the campaign not only encourages people with HIV or at risk of HIV to actively seek medical facilities to be tested and treated as soon as possible. The message U equal U also has a positive impact on public awareness, reducing stigma against people living with HIV.
Greetings from Vietnam on VTC10 NetViet. In recent years, Vietnam has gained remarkable achievements in HIV/AIDS prevention and reducing HIV's related stigma and discrimination. However, a lot more is required. And in today's show, we have a conversation with Dr. John Blanford, the country director of CDC in Vietnam, on this topic. So thank you for joining us. You have just come out telling that you are a gay man and you are living with HIV. So why did you choose this time to come out, if I may ask?
So in fact, I've been living with HIV for 33 years, since 1985. And I've been open about my infection, about living with HIV for 25 years. Last week we had an event to showcase the work that CBOs had done around getting out the K equals K message. And it was a large group, a few hundred people, but I looked out in the crowd and I saw among these representatives from community-based organizations, from organizations representing people living with HIV, I saw all these persons in their 20s and 30s. And when I looked out at their faces, I saw myself 25, 30, 35 years ago. So I wanted to share the importance of the message, both as CDC director, the importance of the science, the importance for public health, the potential for the impact on the HIV treatment program. At the same time, I wanted to tell them how important their work was to me personally. So I told them this work is important as me as a gay man, as a member of a key population group, as a gay man who's been long living with HIV, and as a gay man who's living with HIV whose partner, whose husband of 23 years is HIV negative. So I wanted to use a moment to say this is why it's so important, because we need to not only do everything technically right to find people who are at risk for HIV, to have them tested. We need people to come forward and say, I think I might be at risk for HIV. So I was trying to communicate that message. I hadn't realized this would be a story in itself, but it's fine. I think it's good for when I'm looking out at these faces who are 25, 30, 35 years older, for them to see that an older face, one that no longer has hair, whose beard is gray, has had an HIV infection for many, many years, can rise to important positions, can have a full healthy life, and can still feel the personal impact of effective programs.
Can you tell us about the meaning of the message U equal U or K equal A with the people living with HIV?
Sure, certainly. So U equals U, or undetectable equals untransmittable, is a global movement to build off the science, the profound, convincing science, which tells us that once somebody is on treatment, if they take their drugs and adhere to them, that they can achieve a viral load, a viral count that's so low that they can no longer transmit to their sexual partners. So hence, undetectable equals untransmittable. In Vietnamese, this is K equals K, or Hung Phát Hien Bang Hu Le Chuyen. We're trying to spread that message because we think that's one of those opportunities to address the stigma and discrimination. For people living with HIV, one of the greatest sources of stigma has been that once you got the virus yourself, you thought yourself potentially was a threat to your partner. You feared your partners thought you were a threat. It made it difficult for heterosexual couples who wanted to have children. They were worried about potentially transmitting to their partners. For all sorts of couples, it put a distance between the couples. They could manage their HIV well with condoms, but it was different. And so the important thing is, this is an opportune moment, if you're living with HIV, if you think you're at risk for HIV, to get tested, to get onto treatment. And if you do that, 6 months later, we can confirm that you're responding to the drug and your viral load has dropped. And then 6 months after that, we would confirm it. So within a year, you can get onto treatment and know that you can no longer transmit to your partner. This is an amazing moment in the HIV response. It's rare that we have such good news without qualification.
So can you share more with us about the activities that your organization has been working on here in Vietnam so far?
So within Vietnam, CDC works closely with the Ministry of Health through VAAC, with community-based organizations, with implementing partners, in order to implement programs to address the HIV response from case identification, for helping people to get tested, to know that they're if they have an HIV infection, then to link them to treatment and get them into treatment programs. We have a priority right now to work closely with the government of Vietnam and other partners to achieve the 90-90-90 targets in 2020, and doing that first in the 11 surge provinces around Hanoi and Ho Chi Minh City. That would comprise more than 50% of the HIV burden in Vietnam. They're ambitious goals, we think they're achievable, and we're all working together to try to make that happen.
Science has proven that for every HIV patient after treatment, the probability of infecting others can be as low as 0. The results of tests conducted on a large scale will reinforce this message. In the past 3 years, the U.S. Centers for Disease Control and Prevention (CDC) in Vietnam has collaborated with the Ministry of Health to build capacity for laboratories at central and provincial levels so that they can implement HIV testings in patients, helping treatment facilities to plan for testing to ensure coverage of 80%.
Trong năm 2017 cũng như là năm 2018 thì với cái nguồn lực từ PEPFAR thì chúng tôi đã giúp thực hiện được xét nghiệm cho hơn 50.000 bệnh nhân đang điều trị ARV tại Việt Nam. Và cái kết quả xét nghiệm tải lượng HIV ở Việt Nam thì nó có một cái kết quả mà phải nói là tuyệt vời, cao nhất ở trên thế giới, với 95% bệnh nhân có tải lượng HIV dưới 1.000 và 93% bệnh nhân có tải lượng HIV dưới 200. Và qua đó thì chúng tôi có thể hiểu được rằng là đến 93% bệnh nhân đang điều trị ARV ở tại Việt Nam không còn khả năng lây truyền HIV qua đường tình dục cho bạn tình của họ.
Vietnam has achieved impressive results in the treatment and control of HIV disease. However, there are still concerns about increased infection among high-risk groups, especially homosexual people in urban areas such as Hanoi and Ho Chi Minh City. This is a topic that CDC Vietnam's experts are investigating. Experts expect U=U message could encourage high-risk people to actively seek for support to be tested and treated as soon as possible.
I remember when I started work here in Vietnam 14 years ago for the HIV program, people were presenting to the clinics very late. They knew they had HIV, they were getting sick, they were about to die. But they wouldn't come into the clinics until they absolutely needed treatment. And why they did that? Because they were so afraid of the stigma. They were afraid of people disclosing their status. They were afraid of the shame they would be treated with when they went into the clinics. And now it's changed. I think with the progress that the government of Vietnam has made with the community and with international partners, we have an amazing HIV program, and you can see it.
Can you share with us about the remarkable results that CDC has gained in supporting Vietnam to prevent HIV/AIDS?
Certainly. So CDC works primarily in the HIV space. We work primarily through PEPFAR. All our funding comes through the PEPFAR, or the U.S. President's Emergency Response for AIDS Relief, which was set up in 2003. So we're celebrating the 15th year of PEPFAR. And CDC is one of the major implementing agencies that implements PEPFAR in Vietnam. I think our successes stem from the very start. CDC worked with the Ministry of Health to establish the first treatment sites in Tropical Disease Hospital in Ho Chi Minh City, in Bach Mai Hospital in Hanoi, the first pediatric treatment for children at Children's Hospital in Hanoi, and I'm sorry, in Ho Chi Minh City. And since then, we've been working with CDC, with its implementing partners, with the government, in collaboration with other implementing agencies under PEPFAR to rapidly increase access to treatment. We're a partner. The response is really driven by the government of Vietnam through the Ministry of Health. The community-based organizations are central to this, but we're lucky to have partnered within a strong, effective program. We have the resources, we have the quality programs that anybody who is HIV infected or at risk can get tested and can get linked to treatment. We just need to get them into the services, but the services are quite strong.
As far as I know, you have been working here in Vietnam for 2 years and a half. So what is your comment on the situation of HIV-related stigma and discrimination here in Vietnam?
So I think firstly, to talk about the strengths of the HIV response in Vietnam, I think one of the things that's notable is that once people are diagnosed and get linked to treatment, they do very, very well. Once people are on treatment in Vietnam, they get to a very low, they respond well to therapy, they get to a very low viral count, which indicates both that they're responding to treatment and that they're taking their drugs. And this reflects both the strength of the treatment programs that are provided in Vietnam and the adherence of the patients to taking their therapy. And in fact, when we look at those numbers globally, Vietnam's national HIV response has among the best viral response rates in the world. The challenge is that we only have about 50% of the people who are infected with HIV actually on treatment in Vietnam. So we're having problems in identifying and linking people to treatment. And we think a lot of those problems are due to the stigma that's associated with HIV infection. So if people can come forward to be tested, and once tested to go immediately on treatment, we know the success rates are very high, and they will have, if they take their drugs every day, a long and normal life.
Could you please share with us about the experience or the success story in the United States in preventing HIV/AIDS that Vietnam can learn from?
I think every country, every program has something to learn from others. I think the United States could learn a lot from Vietnam in terms of the viral suppression rates that are achieved once patients are on treatment. The United States in certain cities has done very well in bringing together the getting people who are at risk onto treatment. So that certain cities like San Francisco, New York, Chicago have done very well in getting people who are already infected onto treatment, and at the same time getting people who are HIV negative but at substantial risk onto effective prevention measures. The newest of these is pre-exposure prophylaxis, or PrEP, where people can take drugs even when they're HIV negative in order to prevent getting the transmission of the virus themselves. So the combination of treatment for those people who are already on treatment, already have an HIV infection, and PrEP for those people who are at risk of an infection have driven down the incidence of new infections dramatically in those cities that have implemented these programs aggressively.
Once again, thank you for joining us and for your meaningful sharings today.
Okay. Great, thank you.
And that's all we have for this episode of Strength Vietnam Today. For comment and feedback, don't hesitate to write to us at strengthvietnam@netvietttv.net. Thank you for watching and goodbye for now.